We talked with people in Wisconsin to learn how they view COVID-19 vaccines. These are personal opinions. They may differ from your own. We invite you to simply listen.
Global confirmed cases of COVID-19 go over 10 million at the weekend. In the United States now has more new confirmed cases, now over 500,000.
COVID is not kind, and it treats people very differently. For one person, they would just be like, oh, it's like a walk in the park. And then for some, it's just like, it may be the end of their life. Just in the Hmong community, we lost so many individuals that left a lot of holes that we can never fill.
My father was the first person in Milwaukee to pass from COVID. He died March 19th. March 19th, 3 years ago.
Me personally, I did not catch COVID at all. I don't know anybody personally that got sick.
My daughter got COVID this spring, but it only presented as like a mild cold.
It was around the summer of 2020. I was hospital for about 21 days. And I can remember some of the nurses talking to me and coming while I was in the hospital. And it looked like to me they had spacesuits on of some kind. But they were coming in and letting me know that, hey, there was about 10 people on this floor with COVID. I was the 10th person, but 9 of those people had passed away.
Me dio en 2 ocasiones COVID y fue más bien como una gripe, un catarro normal. Sí, lo único diferente que sentí fue mucho dolor en la espalda baja.
In December of that year, my sister became very sick and she got COVID and she was in the hospital and we lost her.
I've been a respiratory therapist for 22 years. To be a healthcare worker and to see the people dying every day, it was heartbreaking. It taught me to trust in God. I prayed a lot, I grew a lot. Because to do the job that I did took strength.
I just want people to know that, this virus took a great man for me, a great man for my family, and that I'll never forget it. When people bring COVID-19, the first thing I think about is my father and how he lost his life to this virus.
We asked people in Wisconsin, did you get the COVID-19 vaccine?
My wife is vaccinated, and me and my 2 kids are not.
And coming from the military background I come from, we take vaccines all the time. So for me, it was an easy decision for me to go ahead and, get the vaccine.
Yo decidí no tomar la vacuna por el momento.
I don't trust any of this anymore.
I wanted it as soon as I could get it.
How did you make your vaccination decision?
COVID did way more damage to me because I have pre-existing health conditions. I have a heart condition, and I also I'm epileptic, which now I have been deemed as a long hauler, and I still suffer for some of the damage that COVID has done. People don't really understand that it's not just because you didn't or it didn't affect you or you didn't end up in the hospital. There are more damaging things that have happened to people because it's so unknown.
After a little while, I'd read, I don't know how many articles, and I got to the point where every article I read never said the same thing as the other one. There were so many different explanations and variances. And
if anybody said, well, wait a minute, I do have some safety concerns, well, then it wasn't, well, no, that's not a concern because it's, oh, you're spreading disinformation. So if it's not safe, how would we know? Because nobody can say it's not. Safe should mean we're willing to look at the evidence and we're willing to talk about it.
I would say my number one reason for not getting the shot would be because when it did come out, it didn't stand for what it was supposed to do. It seemed that a lot of people that I personally know who got the vaccine actually got sick and diagnosed with COVID after getting the vaccine.
And it's like, well, if you can be vaccinated and carry it and pass it on to other people, how effective is it?
I got the vaccine both before I was pregnant. I got 2 shots before I was pregnant, and I think that I got 2 doses while I was pregnant, and I didn't have any side effects to those either. I was very excited because I was actually gonna give antibodies to him, and that made me feel significantly better about a baby being born into the pandemic. I was very thrilled and excited to be able to get those for him and give him some protection.
Now, even after having COVID, I want to take every precaution because hard as it was on me, I don't never want to experience that again. So I am 100% for it. I respect everyone else's decision, but because of the effects that it has had on my life, the struggles that I'm still dealing with at the moment, I believe that because I am vaccinated, now I haven't contracted it, and it's put up a little barrier.
Every time they say it's booster time when I go get my physical, I'm gonna take it. So I just tell people that I think it's worth it to take the shot. The reward outweighs the risk.
There's so much in health, so many nuances in healthcare that people don't understand. Like, for instance, okay, I get a colonoscopy. My understanding is if you don't get a colonoscopy, there's a 30% chance that you'll get cancer before you can do something about it. Okay, well, gee, there's a 70% chance that I won't. And, I think healthcare workers tend to think of, well, if there's a 30% chance, why wouldn't you do this and get it down to 0?
I think that there's a good reason to just take a step back and say, okay, what sort of data do we have? And I relied on good data that we have at the local level, and ultimately the recommendation from the CDC and our state health department that said, this vaccine is helpful. It will decrease your chances of getting seriously sick.
The shot did not cause the side effects that I have now. The disease itself did that, the damage that it did to my system. I believe the shot helped to fight it off. I didn't really try to pressure him into doing it. I tried to share what information I had.
It's been an open dialogue. At the end of the day, like I said, you have to make a choice for yourself. I didn't try to persuade him one way or the other. For myself and my kids, I chose not to. It was so new, and I didn't understand how they could test something so fast and get the correct results.
Pues también pensaba en los efectos secundarios de la vacuna. Así que eran muchas cosas en mi mente que dije, no, voy a esperar.
I really wanted the vaccine. I remember how crazy happy I felt when I got it. I just felt relief. Relief not because I was never gonna get COVID, I just felt like it was the first step to protecting myself.
I was very eager and excited to be able to get my life back, and the vaccine was kind of the way that I could do that while keeping myself safe and keeping other people safe too.
I know what it feels like to be very sick, and I'm totally familiar with people that have passed on due to the fact that they're having COVID and even having some underlying conditions. And I find myself to be very blessed. And that's why when it comes to being vaccinated, anything that has to do with COVID, I am the #1 person to say, hey, look, get it done.
Even if you don't want to get vaccinated, that's your choice. But think about the people who are around you.
And people just have to search within themselves and know their own bodies and what's best for them. I don't think there's a blanket answer for everyone, because everyone's body is different.
I can't make you be vaccinated. I can't make you wear a mask, and I can't make you practice social distancing. But I can ask you to respect everything about me and the loved ones that may have the pre-existing conditions. If it's something, respect our boundaries as well.
Talk to your, primary care physician, your doctor. I mean, and get that knowledge. Find out, what's in the vaccine, what goes to your body. Your body's your temple, so you want to protect it. But it's also, we have this virus out here which is still affecting a lot of people.